Yeah, so my name is David Schaffer. I'm an emergency physician and medical toxicologist here at Prisma Health in the upstate. So I'm based out of Greenville. For some background, a medical toxicologist is a doctor who specializes in identifying and treating patients who have been exposed to some type of toxin, whether that is drugs or medications, chemicals, heavy metals, or even snake bites. And so in the winter time, particularly carbon monoxide is a big part of what we see in the emergency departments. We know that nationwide, there's about 100,000 or maybe even more emergency department visits in the United States for carbon monoxide exposure. And unfortunately, there's about 500 people that die every year from carbon monoxide. And the key problem here is that carbon monoxide is an odorless, tasteless, colorless gas. As the concentrations rise, there is nothing that you can do to notice that it is there, which is why it's very important that everyone should have a carbon monoxide detector in their home. And you need one for every floor. Carbon monoxide does not really rise or sink. So for every level in your house, you need another working carbon monoxide detector. The reason this particularly comes up in the winter is because of our sources of heat. And so anytime a fuel is burning, there is potential for exposure to carbon monoxide. Electric heat does not pose a significant risk, but as you are burning propane or natural gas, burning oil, et cetera, you are potentially exposing yourself to carbon monoxide. And one of the big things we saw during Hurricane Helene as people were losing power and switching to their generators was improper use of those generators too close to windows or in poorly ventilated spaces or even indoors. And those are typically run on gasoline or natural gas and generate carbon monoxide. And we had, unfortunately, many patients here in our emergency department in Greenville who came in with carbon monoxide poisoning.
I'm Anna Arender. I'm with Fox, Carolina. But I just wanted to ask you too if folks are at home. I know that we've been warned that we might have some rolling blackouts or there's going to be some energy that or power outages that go out because of these colder temperatures. So what can people do other than maybe getting carbon monoxide detectors? I mean, hopefully they have some, but um kind of those very basic things to keep in mind or look out for as far as symptoms go too.
Yeah, you're exactly right that one of the best types of prevention is actually just recognizing the symptoms because they can be subtle. And almost always the first symptom is going to be headache. That is by far the most common complaint. Even people who never get headaches will often develop a headache as they're first exposed to carbon monoxide. Typically, the next symptoms are nausea and even vomiting. Because carbon monoxide reduces your ability to provide oxygen to your vital organs, some of the next symptoms can be chest pain, or even drowsiness, and unfortunately, even loss of consciousness, which is, of course, very serious after carbon monoxide exposure. Other than recognizing the symptoms, though, and of course, if you do have those symptoms and believe you might be exposed to carbon monoxide, the absolute first thing, of course, is to get away from the source of exposure. Open windows, get out of the house, remove yourself from that source of exposure. But other things that you can do to prevent, of course, like we said, the carbon monoxide detectors. If you're using a generator for power, yes, you must operate that outside, but don't operate it right next to a window that's open that's going to put some of that carbon monoxide back into the home. Don't use a gas-powered stove to heat your home. So yes, every time you turn on your gas stove, you are releasing a little bit of carbon monoxide, but it's that extended period of time trying to heat a small space. If you're using a radiator or furnace that is powered on gas, those things need to be evaluated every few years to make sure that they are filtering that exhaust out properly. And then if you are unsure if you might have been exposed to carbon monoxide, most hospitals can test you. It's a blood test to see if you have carbon monoxide in your blood. And in many places, fire departments are willing to come out and test your home for the presence of carbon monoxide as well.
Dr. Schaefer, could we talk a little bit about some of the other problems with the cold? Of course, we in the South are not used to these cold temperatures. Frostbite can be a concern. People don't think of that as being a problem in the South. Uh, some good tips to prevent that and also some ways to recognize it.
Absolutely. You're right that we often in the Southeast United States are not used to thinking about things like hypothermia and frostbite. And I think one of the things that surprises people the most is that hypothermia does not just occur in the winter. It can even occur in the summer months. And so many cases of hypothermia that come into the emergency department are actually when the ambient temperature outside is around 50 degrees, and which is not something you'd expect. And one of the key things I tell people is that water or moisture is the biggest risk. So if you get wet and you are out in the cold, that is going to be a major risk factor for hyperthermia, even in temperatures in that 40, 50 degree range. And so, one of the best things you can do is if you're going out, on the weekend with your dog or hiking, is to not wear cotton on the layer closest to your skin. So it's best to use quick dry clothing, things made out of polyester or nylon on that layer closest to your skin so that you don't become wet in cold temperatures. Pack extra layers, bring gloves, mittens, earmuffs, because it is those extremities like the hands, fingers, toes, ears that are most exposed to frostbite.
So, what are the signs that you're having problems with frostbite?
The first thing, we all know that feeling of a cold hand. We've been out in the winter and had a cold hand. And when you start losing sensation in that hand or foot or toes, nose, ears, that's typically the first signs. Sometimes there's tingling as well. And then it turns into pain or discoloration of the skin. So as you see that skin start to turn purple, maybe white in some people, or even a dark color, that is a very concerning sign that you need to get that extremity warmed as soon as possible.
Well, most people know when they're cold, but what are the signs that they're slipping into hypothermia?
Yeah, so hypothermia we don't always recognize early, and there's populations that are at particular risk. So older adults and then small children. Small children in particular in the winter, they're not as good at preserving heat as us adults. Okay, and they may not be able to communicate or tell you that they're at risk. So if you're taking your kids out in the stroller for a walk, they need to have a hat on, they need to have gloves on, and they may not be shivering. They may not be less responsive as you might think someone with hypothermia would be. And so you need to particularly think about those high risk populations in the wintertime.
To kind of piggyback off of that too, I know our Western North Carolina neighbors obviously hit by Helene. Now they've been hit with extreme cold temperatures and this Arctic air that's kind of moving through. So what are kind of the harsher effects on the body with cold weather? I know sometimes when you walk out, you get that shock to your body or your lungs, and it kind of feels almost painful sometimes if you breathe that in. But especially for those who may already have like a pre-existing condition, and is there negative effects for them to go outside? Are there ways to kind of regulate their body temperatures too?
Yeah, so it sounds like the question there is, are there risks of going out in the cold other than hypothermia? Would that best characterize your question?
Yeah, yeah, and I guess even speaking just maybe people who already, like I said, have those pre-existing conditions or
Mhm.
like chronic lungs
Yep.
issues or asthma, anything kind of like that.
Yes, absolutely. And I know my pulmonology friends will be dealing with this frequently, but we do see it in the emergency department that those who have a history of asthma or COPD, emphysema, chronic bronchitis, there is an increase in risk of those lung problems during the cold weather. It can cause essentially a spasm of the small airways in the lungs that can make it harder to breathe, increasing cough. And the other thing we watch during the wintertime in particular with this is the air pollution levels. And so there are some groups that are going to be particularly sensitive as the air pollution rises, and others that may not have those same problems. But yes, in the cold weather, it can increase the risk for those with asthma or COPD to have an exacerbation of those chronic illnesses. And we do see that in the Southeast, in Western North Carolina, upstate South Carolina, et cetera.
Well, piggybacking off of what Anna just asked you, we always hear about cardiovascular issues being a concern in cold weather too, often in connection with snow. I know in Western North Carolina, well, I don't know if they're getting it with this particular system, but it's been a problem up there with snow. What do people with heart conditions need to pay attention to in cold weather?
Sure. So it's not just the cold weather itself. Often it is those activities that you're talking about that place patients at risk for an exacerbation of something like chronic heart disease. And so shoveling snow is sort of a classic example of something that could trigger a heart attack. And so really the most important thing is to recognize those signs and symptoms that would warrant someone to call 911 or go immediately to the emergency department, particularly chest pain in an adult, again, particularly with a history of chronic heart disease. That pain may radiate to one of the shoulders or down the arm. Sometimes it's a numb or tingling feeling in the arm or in the neck. Those types of symptoms absolutely cannot be ignored and need to be seen in an emergency department immediately.
And a follow up on the hypothermia situation. Um, if you're with somebody or if you yourself are experiencing hypothermia, what should you do right away? Should you try to warm up your extremities?
Yeah, that's an interesting question. So if you do think that you have an extremity that's at risk of frost nip or frost bite, there are a couple things that you can do first, and just particularly easy and obvious is try to find a way on your body to get that warmer, whether that's taking a hand and putting it in a tight space, such as in the armpit, trying to find a way to get it warm. Don't rub the extremity. Don't try to massage the hands or fingers to warm them up. And then try to, of course, get to a hospital or somewhere where it is warm. And one thing we tell people is that you don't want to get it warm and then immediately get it cold again. So if you think you may have to get that extremity cold again before you can get to a hospital, then you need to hold off on trying to expose it to dry or moist heat. We do try to use moist heat if possible. So warm water, not hot water, rather than putting it up next to a hair dryer or a furnace or something like that.
Thank you so much, Dr. Schaffer. Do we have any other questions from our media partners before we close it out? Did we hit everything for the group?
I have one more. I don't know if you can touch on this. Do you have any advice on, if people don't have heat or the shelters, they may not have access to them. Most people do. Is there anywhere people you recommend go or ways they can warm up if they're homeless or if they don't have the resources?
Yeah, that's a challenging situation all over the country every year in the winter times. And I know there are various groups who do their best to help those who are without a home to have access to warm clothes, warm blankets if they're going to be staying outside. And some of those methods that people use, unfortunately, are what has led to carbon monoxide poisoning every single year. So, of course, the first thing is bundling up, covering those extremities, lots of warm clothes and blankets. And, most of the shelters in the area will, of course, have access to heat for those without a home. There is always, if there's a major concern for a medical illness related to cold exposure, the option to go to the emergency department where in many places they may have social workers or case managers we try to help those patients have a safe way to get back out into the community.
I have one final question. You always see people out in this kind of weather running. Should people avoid strenuous activity when it gets to a certain degree point?
I don't think you have to necessarily avoid strenuous activity just for cold weather. I do think that proper preparation is most important. So if you're going out for a run and you're thinking you're going to be hot and only wearing, 2 layers, a t-shirt and a light sweater, and it's 20 degrees outside, you may want to consider how far you're running from the house. Because if you do, let's say, sprain an ankle or need to stop for some other reason, you may have a 3-mile walk back in 20-degree weather. So it's all about being prepared for these cold temperatures this season.
Dr. Schaffer, this is Sandy. Are there any key takeaways you want to leave with the folks today?
Yeah, I think from the carbon monoxide perspective, just recognizing that those symptoms can be very, very subtle. They can mimic a flu or a stomach bug. And so if you have a headache, nausea, vomiting, chest pain, feeling kind of confused or drowsy, particularly if others in the house are suddenly having those same symptoms, you must try to get out of the house as soon as possible. You can always call poison control. That number is free to use. It's 1-800-222-1222. You can look that up online if you forget it, and they can give you some advice. But the first thing is to get out of that source of exposure. And if you are continuing to have symptoms, to go to the hospital for an evaluation. And then in terms of the risks with the low temperatures, just recognizing that certain populations, such as those with chronic lung conditions like asthma, COPD, emphysema, may be at increased risk for pulmonary or lung complications, and that other high-risk populations are small children who can't preserve heat as well as adults, and then some older adults who may have chronic conditions that predispose them to significant problems from the cold temperatures.
Thank you so much, Dr. Schaffer. We really appreciate your covering so many things related to what these cold temperatures can mean to folks. And I would say, I just add to that, let's all be neighborly and check on our elderly neighbors and folks who we know may be vulnerable as we face this weather event in the next few days. And thank you again, all of you, for joining us quickly for some great tips about facing the cold weather this week and getting further into the winter time, because I think we'll probably have another spell of it before it's over.
Thank you all so much.